Now, let me ask you for your perspective. I've spoke to some cardiologists in the past, and when I asked them about the future of cardiovascular health, a few of them have mentioned before that they think cannabis use and the sort of normalization of that is something that we're going to regret in the future as we learn more about the way it impacts cardiovascular health. Is that a justified feeling as of right now, or is that a little bit of an extreme reaction?
I that's actually a really good point. I think we're too early in the story to truly state. Now, in terms of smoking cannabis, absolutely there are problems there because the carcinogens that are found within cigarette smoke are very similar to what is also found within cannabis. And the second thing too, I've had some patients say, well, I'm going to vape. That must be safer. No, it's absolutely not safe. In fact, it may contain this vitamin E solute, which has been also associated with lung injury. So in terms of smoking cannabis, my opinion is the fact, absolutely not. I think that we're not jumping the gun on that there are hazards definitely associated with that in particularly cardiovascular, because we do know the acute effects from smoking it in terms of hypotension, tachycardia, and if you have underlying cardiovascular conditions, this can possibly exacerbate that. When it comes to the edibles, I think we're still too early in the story to know. Until we have some of these prospective studies, there are some, again, there's no really documented cardiovascular benefits out there with regards to oral cannabis. There's a lot of theoretical potential benefits in terms of maybe some antioxidants, some anti-atherosclerotic effects, but that's all, it's all hypothetical. So I don't know. We're at this point, and I think that the cardiologists should be hesitant still. They need that. That's the reason why, and I'm kind of glad to hear that, because we hear a lot of the benefits, but we also need to understand the risks. And again, the observational data that's published that does show some red flags. And but again, I think this is an evolving story. And again, data come out. I get information almost every day with regards to things that are new and recently published. And so again, I would just stay tuned.
Okay, and now as we look forward to those prospective studies that hopefully will be in the works soon, the reality is we won't be able to learn everything we want to about this all at once. What do you think are the most important topics that need to be addressed once these prospective studies actually sort of get rolling?
Well, one of the things too is with regards to safety within some of our vulnerable populations. I can say here, particularly in Colorado, since this COVID crisis, again, we had when we had the initial shutdown, the only three places that really weren't shut down was alcohol, grocery stores, but also pot shops. And so we've seen a huge uptick, especially during this time period, with regards to cannabis use, and particularly within 17-year-olds and higher, also a very large uptick within very young adults. And so we need to be able to explore some of the risks that are associated, the benefits, but also, again, the risks within these vulnerable populations. We've seen an uptick, actually, believe it or not, within the geriatric population, and realize, again, they have at least 5 or more chronic conditions, take at least, in some cases, 10 or more medications, where there are a lot of potential for drug-drug interactions to exist. So we need to be looking at those. We have very limited data when it comes to pregnancy, and also within the transplant population as well. I can say, because I deal in heart transplant, that and we have some data to support this, that we've actually seen significant drug-drug interactions with our immunosuppressants, particularly our CNI drugs. And that's the reason why we really have to say, you can't be using smoking or any form of cannabis and being considered for heart transplant. So these are some of the questions that need to be addressed. But again, 2 things have to happen. Schedule 1 has to go, and number 2 is we need some regulation on the product, because we need to know exactly the amount of THC and CBD in these products. Right now, there's a guesstimate based upon the label, if someone buys it from a dispensary, but even then, there's been data to support that it's highly variable. There's huge variations within these products. So again, there are a few things that have to happen first before we can move forward with